So today specifically, I want to talk about, continue what we discussed yesterday. Yesterday we talked about heart failure. Today I just want us to look at the risk factors of heart failure. So if you are new here, you are just joining us today, please and please don't forget to share this video. So let's share this video to our loved ones and friends to get them all in this live stream so we can all learn together. So my name is still Dr. OPJ HUB. Yeah, so we are talking about heart failure. No, usually when we talk about heart failure, we think it's something that usually starts just within a day or some few days. But then the truth of the matter is that heart failure actually starts way back. It takes a very long time for you to see the manifestation of um, heart failure. So that's why I want to talk about it today. So we are going to look at some of the risk factors. What are some of the major causes of heart failures? And so that you be mindful of, you take absolute precaution. And once you're able to do this today, your tomorrow is secured from heart failure. So just with a little recap, even as we wait for you to share the videos to our loved ones and friends. I remember yesterday we talked about the heart failure as, so please don't forget to drop a comment in the comment section and leave, you know, yeah, just say something. You can ask your questions and I would like to answer them as well. So yesterday we said that heart failure is as a result of, we define heart failure as the structural and the functional, failing of the heart. That's basically what we said. So the heart has a structure. If any part of the structure get damaged, or the function is to carry blood to all parts of the body, and if it fails to do that well, then we say it's heart failure. Yesterday also we came to conclusion that the heart can function at 100%, or it can function at 80%. It can function as low as 30%, 20%, 10%. So yesterday we all agreed that the heart can function like that. So if it's functioning at 100%, that means that your heart is really functioning well. If it's functioning as 80%, you can score yourself like, let's say, A. But if it's functioning as low as 40%, then we can conclude that the heart is failing. Okay, so we define that heart failure is actually the structural and the functional failing of the heart. Then we can say heart failure. Do you get that? Exactly. So we also looked at the common symptoms of heart failure, and I remember I said quite a number of them. I said if one of the warning signs is when you get tired easily. So when you usually get tired easily, this is as a result of the heart not pumping enough blood to the muscles and the tissues of the body, because the muscles and the skeletons, they need the blood supply to help you in your movement, going about, jumping, talking and stuff. So if the muscles is not receiving enough oxygen from the blood that is being pushed out by this heart, you find it very difficult to do the daily activities. So when you easily get tired, that's a warning sign of heart failure. Yesterday as well, we also talked about having what we call palpitation. And I said palpitation is when your heart you feel like your heart is beating even without doing anything. Okay, so you are just there, you feel like the heart is beating, and this is as a result of the heart trying to beat or push harder for the blood to go to all parts of the body, and in so doing it even beats even without you not doing exercise or not doing exertional or not exerting a lot of energy. So the point I was trying to make, that if you really run or sometimes you do some jogging, you realize that your heart is beating. That experience happens even when you're not doing any very hard activities, and that's what we call the palpitation. So when you begin to feel that, that's also a warning sign of heart failure. Yesterday, so I also said when you cough, and this particular cough has been there for a while, And what we are looking out for in a cough is what we call the fruity cough. So when you cough, you can see that there'll be a white discharge from this. Yeah, that's one of the warning signs of heart failure. And I think I talked about difficulty breathing. Exactly. That was one of the things I mentioned. That difficulty breathing is one of the warning signs of heart failure. And anytime you walk within a short distance, you get very tired in the breathing. And then one of the things, once it's there for a while, it progresses. I mentioned that when you lie down flat, you find it very difficult to breathe. That is what we call the autopnea. And then when you also sleep in the night, in the middle of the night, you wake up and you find it very difficult to breathe. And that's what I said we call the paroxysmal nocturnal dyspnea. So when you notice any of this difficulty breathing for a while, your mind will be thinking, now, could it be a heart failure or stuff? I also talk about the fact that sometimes some people see their body swelling. Usually the ankle, the lower part of the legs gets swollen. And when you touch it or press it, you realize that it dips. That could be one of the signs that your heart is failing. Even with that, you can see it in the kidneys as well. So I mentioned quite a number of them. And I even said that when you even have weight gain, there could be possibility of you having a heart failure, especially if you're having fluid retention. Do you get it? So these are some of the warning signs of heart failure I think I talked about. Then we looked at some of the risk factors and stuff. So today we want to look at specifically the risk factors. What are some of the risk factors of heart failure? So today, as I said, we want to look at what are the risk factors of heart failure, because I told you that heart failure takes time for you to see the manifestation of the signs and symptoms. So kindly do me this favor to share the link with your loved ones and friends so we all know what are some of the risk factors. Once we know the risk factors and once we avoid them, heart failure will be far away from us. Do you get it? Heart failure. So we're going to look at the risk factors one by one. So I think I wrote my notes here. We'll look at the first risk factor of heart failure. Now, the first risk factor of heart failure is high blood pressure. Now, this is very important. I would like you to know that this is very important. See the heart as a pump that pumps blood to all parts of the body. Now, your heart has been beating right from the day of birth, even till now. Your heart has been beating. So just imagine that it's a pump that pumps the whole, community, your whole community. For look at your age now, probably let's say 30 years, or maybe 70 years, or maybe you are 80 years, or let's just say you are just 18 years. So for every blessed day, we have 24 hours in the day, okay? And every 1 hour, we have 60 seconds, makes 1 hour. So just imagine 24 hours times 60. Let's do the calculation. 24 times 60. If you have a calculator there, you can calculate it and keep the answer in the comment section for me. So 24 hours times 60 seconds. I mean 60 seconds make 1 minute, sorry, and then 60 minutes makes 1 hour. So 24 times 60 minutes, that's going to give you quite a number of minutes that the heart has been beating just only for a day, and multiply it for a week, and then a month, then for a year. Then let's say you are 20 years, multiply it by 20 years. That means your heart has been beating that quite number of times, all this while non-stop. Even when you are sleeping, it is still beating to push out blood to all parts of the body. So you see how very important the heart has been working all this while. Exactly. Now, when you have high blood pressure, that means that your blood level or the heart takes quite a number of more energy to exert pressure to pump the blood out to the part of the body, because with a high blood pressure, it means that your heart, which serves as a pump, is like now doing double of its work or triple of its work. So for about 20 years that your heart has been beating, when you are having a heart failure or high blood pressure, your heart does twice or thrice or even quite more than that to beat. Do you see that? So it puts pressure on the muscles of the heart. Don't forget that when the heart beats, it is actually the contraction and relaxation of these muscles that helps push the blood through the aorta to all part of the body. So if there's kind of pressure on it, the muscles start do this contraction and relaxation to push the blood, then becomes kind of very weak, and then eventually they lose that elasticity that they have, or that ability to contract and relax, and then you can fall, that can lead to heart failure. So it has been known with evidence that actually heart failure, one of the leading cause of heart failure is hypertension, high blood pressure. And usually these high blood pressures are not well controlled. So people who are having high blood pressure and they don't control it well with their medication will eventually end up having what? Heart failure. So yesterday I also made the fact that we say high blood pressure is not only found in the aged or the older people. We have young people in their 20s, 18s, 30s, 40s now developing a lot of high blood pressure. And that is as a result of, lifestyle and other stuff, genetic. A lot of young people are having high blood pressure. Even in children, high blood pressure can be found in children. So when we mention high blood pressure, it's not actually as a result it's not only seen in the grown-ups like grandma, granddads. No, you can have it even in young people. So that's one of the things I've talked about, that high blood pressure can lead to the heart overworking, and eventually the muscles walls will become relaxed, and then it will lead to the heart failure we're talking about. So bear in mind that as a heart failure, you need the heart structure. The structure of the heart is failing, or the function of the heart is failing. So let me give you a simple way so that when I'm discussing, you can really follow. So as I said, the heart is like a pump. So if any part of the pump gets spoiled, or as the pump is pumping out blood, any part that is supposed to receive or carry out the blood kind of gets damaged, then we can say that is heart failure. So it may not necessarily be the structure of the heart failing, but then the function, as in the process of it carrying out blood, if there is any blockage or there's any stiffness from the muscle, then we can say heart failure. Please, I hope you get it. Exactly. So I'm going to mention the second risk factors, which is also very important for you to know as one of the leading cause of heart failure. But please don't forget to share this video to your loved ones and friends. Let's share it to your loved ones and friends. Let's share it. Let's share it. Let's share it. Share the link. Oh, share the link. Share the link. Share the link. Okay. So drop in the comment section what you have learned so far, or if you have any question, and I'll be glad to read the comment section. So kindly drop it there. The next thing is what we call the coronary artery disease. That is also one of the leading causes of heart failure. Now, the heart itself, when it pumps blood to all parts of the body, the heart itself receives its own blood supply. Okay, yes, it needs to also receive, because it's also part of it. It's an organ, and every organ receives blood. Receive oxygen to function. The heart is also another very important organ, so itself needs some oxygen to be able to do its activities that it does. Okay, so this heart has what we call arteries and veins that supplies it, what we call the coronary arteries that supplies it. However, sometimes before then, this artery supplies the muscles of the heart so that they can enable it to contract, because the muscles also needs oxygen to contract and relax. Now, when these blood vessels are on the surfaces of these muscles of the heart gets blocked, okay, by, let's say, a clot or something, or a plague, or some, let's say, let me just simply say something like a cholesterol, could blocks this blood vessel, what do you think will happen? That part of the blood, that part of the muscles of the heart that receives the oxygen will be cut off, and so that part will not be able to receive the oxygen. So eventually, that part of the muscle of the heart, dies. What we call, it has died. So it undergo ischemia, then undergo what we call necrosis, and then die. So once it died, that means that that part of the heart's muscles will not be able to do its pumping or contracting and relaxing, and so we can say that the heart has died. So that's what we call the coronary artery disease. So it's as a result of the blocked heart vessels, okay, and eventually the oxygen will not be able to reach that part of the muscles of the heart, and so it will not be able to communicate. I mean, it will not be able to contract and relax well. Yeah, Dr. Dovlo, I can see you. Thank you so much. All right, so that part, yes, thank you. So I really appreciate this. Yeah, so that part of the muscles cannot function well, and so you will not be able to receive the oxygen demanded for the heart, and then that can lead to the heart failure. Another very important thing you need to know is when you have, let's say you have had an episode in the past, you had what we call a heart attack, okay, yes, or what we call myocardial infarction or something relating to that. That part of the heart actually dies, okay. So if that part of the heart, that's the muscle dies, it will not be able to receive oxygen, and so in so doing, the heart cannot be able to pump well as it should pump, and you'll be deficient of oxygen, and eventually the heart start eventually the heart becomes very tired, or the muscles become very tired, and then it dies forever, and then you'll not be able to receive that. All right. Another very important cause or risk factors that's associated with heart failure is what we call cardiomyopathies. Now, with this one, I want to specifically talk about um, alcohol, because long intake of alcohol can actually cause someone to have what we call alcoholic cardiomyopathies. So, as I said, the heart itself is a muscle that contracts and relax. What then happens is that the muscles become enlarged, or the heart become enlarged, and once it becomes very enlarged as a result of overexertion, or yes, the muscles become very enlarged, then we call it cardiomyopathy. We actually have the causes. Sometimes some people are born with their heart muscles kind of very enlarged and weak, and not kind of they lack the ability to really contract and relax and expand well. Yeah, that's kind of genetic, okay. But people who usually take alcohol for a very long time can actually cause these heart muscles to become very relaxed. So you see, yesterday I mentioned that we have the chambers of the heart. So blood comes right to the right chambers, and then into the left chambers, then they move out. Now, these chambers of the heart need a certain structure, or needs a certain ability to kind of structural ability to be able to open up for blood to flow in and close their valves for blood to go out. But because you have taken alcohol for a very long time, the ability or the structure of the heart become distorted. And so when blood comes through into the heart chambers, it's like let's take something like your door, okay? Yeah, your door. You see how your door is. When you close it and you don't close it well, there can be an opening where blood can, like, there can be opening. So in your mind, you think you have closed the door, but then there's an opening that maybe a lizard can pass through and enter into the room. Did you get the picture? Exactly, as a result of overstretched of maybe your door and stuff, and that is what is causing the uh, the feeling of the heart. With that said, we also have some valves, what we call the valves. They control, they are like bodyguards for these chambers of the heart I've talked about. Okay, so as you close the door, ideally they are supposed to close very tightly so that there will not be any foreign organism, or let's say, yeah, backflow of blood and stuff. But because you close the door and there is a problem with the door, either is the door closed well, but it's not closed well, so there's a leakage and there's a backflow, that eventually will cause a backflow of blood, and then that can, with a long-standing valvular heart disease, you can have heart failure. So I don't know if I've made the point very clear to you. The point I was trying to make is that you can have the heart itself, the muscles of the heart, becoming very weak as a result of long-standing alcohol intake, or the valves within the heart also becoming very weak, so that even if you pump blood into the chambers of the heart, they open and then the blood flows through, or they close and they don't close well and blood flows backwards. And so for long standing, that can also lead to a heart failure. All right, so yesterday I also mentioned the fact that once we talk about alcohol, you need to also talk about smoking. And I said that alcohol and smoking has been known to be the leading cause of heart failure, or the leading cause of hypertension, and eventually causing heart failure. So if you remember yesterday, I said that I've come to realize that alcohol and smoking are actually one of the risk factors. A lot of the lifestyle diseases that we have, like hypertension, diabetes, you can find out that either the person is smoking, has been smoking, or he has have what we call the secondary smoking. So this is not you smoking necessarily, but maybe kind of the work that you do demand that you should be closer to the fire for long, and so because of that you have an exposure to smoke. Or you don't smoke but you are around people who who smoke for fun, or the ghetto, so once they smoke and they blow out the fumes or whatever, you get to inhale it, and so that is even more dangerous than the one smoking. And so that one alone can also increase your risk of getting these heart diseases as well. All right. So what the smoking does is that it's actually also have effect on the muscles of the heart. So the muscles of the heart are formed by collagens and stuff. So the smoking weakens this collagen effect, and so eventually the heart muscles become very loose, or they lose their ability to contract, and then that can also lead to the pump being damaged. Do you get it? Please, I hope you are learning something. Don't forget to share this video to your loved ones and friends as well. So we are still talking about that. And one of the very things today that the kidney is a friend. One of they're kind of best friends. Okay. When the heart pumps blood to all part of the body, it loves the kidney so much that it gives about 25% of the blood that's pumped to the kidney. So I see the kidney and the heart as like best friends. Okay, when something happens to the heart, within for a long time, it can affect the kidney. And if something happens to the kidney within some time, it can also affect the heart. So that's what we call the cardiorenal syndrome. So the kidneys and the heart, they are like friends. So someone who has a long-standing kidney disease can end up having a heart disease, and then the heart will become overwhelmed, and then the heart will fail. So that's one of the things I talked about. Now, so so there's one thing a lot of people don't know: anemia. When your blood level is low, can also cause what we call heart failure. So long-standing anemia, when your blood level is low for a very long time, anemia, maybe probably I'll get some time to talk about anemia and look at the relationship of anemia to heart failure. You realize that anemia is also known to be one of the causes of heart failure. So if you have been to the hospital and probably maybe have an underlying disease like sickle cell, and then your blood level has always been low for a very long time, what happens is that when your blood levels are low, that means that the heart has to do more to pump a lot of blood to all parts of the body, because the body is not receiving that enough amount of oxygen. So the body has to try to do more, and that is what leads to the heart failing. So I hope you have learned something today. All right. Yes. So that is one of the things you need to know, that these are some of the causes of heart failure, the risk factors. And in our setting, it is known for a fact that when you are a male, okay, you being a male alone increases your risk of getting heart failure. You being a male, so it's like, even though male and female ratio of getting heart failure, it's about 2:1. Females, comparing females and males, it is known that males get heart failure more than females. Males get heart failure more. And it makes sense because usually at the old all right, so it seems the network is having a challenge though. All right, but I thank you so much for having time to join us. And I hope you have learned something. So we have looked at some of the risk factors of heart failure. Once you know these risk factors, that will help you to make an informed decision to avoid most of these health complications that arise. Thank you so much. I believe you have learned something today. If you have learned something today, kindly drop something in the comment section for me to see that you followed up, right? Yeah, Dr. Dovulu, thank you so much. I really appreciate you commenting. I appreciate that. Okay, so on that note, hopefully God willing tomorrow we'll talk about heart failure. We'll probably look at what you need to do when you know that you have heart failure with all the signs and the symptoms and also the risk factors that I've showed. Okay, get to know. Yeah, I forgot about to tell you about diabetes is also one of the leading cause risk factors for heart failure. So people with long-standing diabetes, it has effect on the blood vessels, and the blood vessels, once they get damaged, blood cannot be able to flow that much, so the heart has to pump quite early and more to overcome the blocked vessels and stuff. That can also cause heart failure. So thank you so much, and I hope you enjoy every bit of this video. Until then, see you tomorrow. Please and please and please share this video to your loved ones and friends so we can all learn together. God bless you. This is Dr. OPJ HUB. Stay safe out there. Until then, bye.